United States of America. Infection from this procedure accounts for about 23 out of every 1,000 catheterization hours. On average, 1 in 4 people dies as a result of acquiring the infection. Through the use of the define, measure, analyze, improve, and control method of quality improvement, it would be possible for the organization to improve these rates and reduce the possibility of lawsuits for negligence, and it would also reduce the overall costs for the facility due to the extended care of these patients. And most importantly, it would reduce the rate of morbidity and mortality from this procedure. The current problem is the excessive mortality rate as a result of the infection. The majority of these infections are a result of bacteria found on the skin, and half of this bacteria is normal epidermal flora. This bacterium becomes a problem when the skin barrier is breached and they are able to enter the bloodstream. These infections can take upwards of 4 weeks to resolve, and in most cases, these infections occur due to poor cleaning of the skin and surfaces prior to the catheterization procedure. To remedy this, checklists should be implemented to ensure that all areas have been properly cleaned, that staff are wearing gowns, masks, and gloves, and that the gloves are sterile. It is also important that the staff regularly check in with one another to ensure that everything is remaining clean and sterile, and to have a plan put into place, such as an all-stop procedure, if it is noticed that something is no longer in the sterile field, so that this can be remedied, cleaned, and they can proceed after it has been ensured that the patient is safe. Weekly check-ins should be utilized to ensure that the infection rates are decreasing after the implementation of the plan. Once the infection rates have decreased by 80%, the check-ins can then be reduced to monthly check-ins. It is important for this organization to decrease the rates of these infections in order to achieve the goal of the hospital, which is to preserve life, as well as maintain the hospital's standards of safety and quality. Thank you.